I'm Dr Arinze Chidiebere Iketuonye. I'm the consultant obstetrician and gynecologist at Regina Caeli Specialist Hospital, Awka. Today we'll be talking about an important gynecological problem. It's a condition that is very common in our environment. That condition is called fibroid. So fibroid is a tumor that grows in the uterus of women in the reproductive age group. That age group is between the ages of 15 and 45 years. And like I said before, one of the major things is that it's common in this environment amongst black women, and has various symptoms. The symptoms can range from heavy menses. When a woman is seeing her menstrual period, it will come out in clots. Some women may also have painful menses. Some others may just have that feeling of mass that a woman will be passing. Somebody will ask her, how many months pregnant are you? Those embarrassing questions, because the fibroid is now growing and growing and growing. Some other women may also have urinary tract symptoms, maybe frequency in urinating, urgency. Before the woman gets to the toilet, it becomes very difficult to hold the urine to the point that the urine may start coming out before she gets to the toilet. And in some women too, because they have the fibroids sitting inside where the baby is supposed to stay, it becomes difficult for the woman to conceive. So those are some of the symptoms that fibroid can present. And sometimes too, fibroid may just be there and will not present any symptom. And in that case, it is asymptomatic. And the treatment option will depend on whether it is symptomatic or asymptomatic. If it is asymptomatic, we don't do anything about fibroid, because like I said, it is common in our environment. If there are 100 women in the reproductive age group, at least 75 may have fibroid of various sizes. Then when we have symptoms like the heavy menstrual bleeding, the woman will bleed and bleed and bleed to the point that she becomes weak, feels very tired, and when she comes to the hospital, she may require blood transfusion. Then we may advise that we need to remove the fibroid at that point. And if you have a woman too that is not embarrassed by questions of, don't mind my vernacular, those kind of embarrassing questions, then we may need to also remove it. Or a woman is always complaining of going to the toilet to urinate. When she gets there, nothing comes out. At that point too, we need to remove the fibroid. The management options include what we call myomectomy. Myomectomy is the surgical removal of fibroids. And the idea of myomectomy is that we want to remove the fibroids and leave the uterus, that's the womb, in a condition that woman can conceive. It's a fertility sparing option. Another surgical option includes removal of the whole womb. Removing the whole womb will be advised if the woman has passed the time of giving birth. For instance, a woman that is 46 years, 47 years, having those symptoms and will come to us, we will advise the woman to have the womb removed, especially if she has completed her family size. If the woman is desirous of having a baby, then we can still do the myomectomy at that point. Then other newer technological treatment options include what we call HIFU. It's high intensity ultrasound.